So my name's Assunta, and I'm going to explain the process of how we explain things to patients so they understand the dental implant process. And my favorite teaching aid is the iPad. I have an app on the iPad that's developed by one of the implant companies to help me aid. So I'm just going to walk you through as if you're one of our patients and give you a little information of why I give this information. So my first screen shows a dental implant and a natural tooth. And I explain to the patient that the first step is to extract that tooth. And when we do that extraction, we do it very carefully because we want to preserve all the bone that's naturally there. And we remove that tooth very carefully to preserve that so we have it later for the dental implant. Once that tooth has been removed, we have a little empty ice cream cone, and what needs to happen is Mother Nature needs to fill that little ice cream cone in. And I explained to the patient that that takes approximately 6 to 12 weeks to happen. And it's very important in terms of the foundation to have that process occur so Dr. Fritz has enough bone to work with to place the dental implant. So once the 8 to 12 weeks of healing has occurred, then the patient will return to the office, and what we'll do is a CBCT in order to plan for the implant. So I let the patient know that this CBCT is very important, as when we take it, we're looking for anatomy that is in the area where we're placing the implant. So on the bottom jaw, we're looking at where the mental nerve is. On the top jaw, we're looking where the sinus is and the adjacent teeth in order for Dr. Fritz to plan that surgery. And essentially what it does is it builds up a 3D volume, and it allows Dr. Fritz to do a virtual surgery before he even touches the patient, so the patient knows that we're doing this surgery, knowing exactly where we want to place it, and it will be a safe procedure. When we place the implant, it will go directly into the area where the natural tooth was. Of course, it's not going to look like a natural root, so I explained to the patient that the implants are different sizes, and they're placed according to the anatomy and the function we expect from that dental implant. And initially, when it goes in place, it has what we call primary stability. So the implant is solid within the bone or stable within the bone, but it's not yet ready to chew on. So I explained to the patient that we seal this little area off on the top here with something called the closure screw, and that prevents the tissue and bone from growing into the area where the crown will go later on. And we put a couple of stitches across that area just to seal off the small incision we've made in order to place the implant. Once the 2 weeks have passed, I explained to the patient that that is only the initial healing of the soft tissue. And what has to happen is the magic underneath. So the bone becomes attracted to the dental implant, and what it does is it fuses with that implant, and that's what gives it its strength. So that bone has to mesh with that titanium root, and the length of time that that takes is anywhere from 8 to 12 weeks for that to happen. And I explained to the patient that this time varies depending on the quality of the bone, so how soft or firm the bone is, if we have to add any bone to the area to reinforce that. So that can allow the time to vary. But what will happen at the end of, let's say it's 10 weeks, Dr. Fritz will uncover the very top of that dental implant. So that little area where we've sealed things off, he will actually make a little opening, sneak the little lid that we had on there, and test the implant to ensure that it's integrated. And then we put a taller attachment called a healing abutment. And that healing abutment acts as a transitional piece between the time that we've uncovered it and the dentist is able to process the crown that goes in place. So once we've done the uncovering, I explained to the patient it will be about a week to 2 weeks before their dentist can place the crown or start the work to prepare for the crown. And what the dentist will do is remove that healing abutment, the transitional piece, take some impressions. Those impressions will go to the lab, and then they will fabricate a tooth that will fit on top of the implant that Dr. Fritz has placed. And I always explain, usually initially before I start the process of every step, is to let them know that Dr. Fritz takes care of the foundation of what the crown is on, and their dentist always takes care of what sits on the foundation. So these things are all key. Sometimes, even though we've allowed Mother Nature to do her job because they've had infection in the area or trauma to the area, that this outside bone can be thin, that we sometimes have to rebuild that, as I mentioned, in the process. And I let them know that we use several types of bone. So we can use your own bone if it's a small area and we just move it over from the neighboring area, or sometimes we need a larger amount. So we'll use cadaver bone or we'll use bovine bone. And I let them know that either type of bone has no living cells in it. There's no blood product. There's nothing to match. It's basically the mineral source of the bone, the calcium and phosphate, and it looks like table sugar. And what we do is we pack that around that area, and then we tuck it all underneath the gum. And as their implant matures, so as the bone becomes attracted to that titanium root, then those cells will also take over the cadaver bone or the bovine bone, and eventually it will no longer be donated bone, but it'll actually be their own bone, reinforcing that area, extending the life of that implant, which is really important.